Alicia Frederick. This girl was severely burned in a house fire. Many of the folks here in Granada still cook inside over open fires, and when Alicia's family was cooking, the house caught on fire. Alicia sustained severe burns. Approximately 40% of her body was burned. When we saw Alicia, we knew she needed specialized care, and we were able to get Alicia that needed care. Chores, which stands for the Children's Health Organization Relief and Educational Services. We're a not-for-profit organization based in Jacksonville, Florida, and provide medical care to children in developing countries. My name is Douglas Campbell, and I'm a pediatrician and the executive director of Chores.
Can you raise your arms way up over your head?
Our primary focus is right here in Granada, where we provide 2 projects a year, every 6 months, since 1989, as a result of a phone conversation between Dr. Beverly Nelson and myself.
As one of 2 pediatricians on the island, our population is about 40,000 children under the age of 16. Let's say the demand is there.
When I heard her plea for assistance to this country, I tried to speak with Dr. Nelson and find out what needs existed in Granada. I was able to make a trip to Granada and speaking with different medical professionals, both at the Ministry of Health, here at the General Hospital, and in the outlying community, we were able to identify some priorities for pediatric care.
I'd forgotten about that.
I returned to Jacksonville and trying to find people to fill these niches. In August of 1989, we performed the first multidisciplinary project right here to Granada, and it worked. There was a good fit between the Grenadan health system and the professionals that we have brought, and we have been providing programs every 6 months since that time.
We care for children both at hospital level and community level.
Beverly Nelson. Beverly makes it work here in Granada. Without Dr. Nelson's involvement and expertise and commitment and drive, the projects we perform here in Granada would not be nearly as successful. She makes the program work.
On a daily basis, we do general rounds at the hospital and do on-call work in terms of emergency situations, yes. Very busy, very busy. Being a pediatrician and knowing that you've made a diagnosis issues sometimes a death sentence in this community. To know that you've made this diagnosis and you can list that child, and in 6 months, someone is going to come along and make a change and bring a cure and bring recovery to your patient. It's phenomenal. On all levels, it makes a difference. It makes a difference.
Chores is blessed to have a number of highly committed professional individuals who return to Granada time and time again to provide their expertise to improve children's health care here on the island.
This is Alicia. Alicia, what's your...
Dean Glassman is a pediatric plastic and craniofacial surgeon. Dr. Glassman has had training around the world and his expertise is vast.
And what I personally did was able to facilitate some of the wound healing on the back of her leg and buttock area and speed that up and get it to be at least a functional area that is not thick, raised, painful scar, and also did not disturb the contour of that area. It's kind of difficult to making this long trip. Well, I think it's critical that we have long-term sponsorship, if possible, from anybody. Financially, there's always medicines that we need that are not something that we're able usually to get in the United States. Bringing people down is always, a lot of times we'll pay for ourselves, some people. Any financial help that would be necessary would be, could be given would be more in that respect.
Our great mission in providing cardiology care here in Grenada is to both treat and prevent the disease that we see here. In Grenada, we have our stethoscopes and we have our knowledge. What we lack is a lot of the technology that we have in the United States. The most common type of heart disease in Grenada is rheumatic heart disease. Rheumatic heart disease is treatable and preventable. What we're asking for, what we can utilize most, are pieces of equipment that a lot of folks would consider to be so common as not even to be on a want list or a hope list. The items that we can make the greatest use of are not even considered advanced medicine in the United States.
How you been doing?
Another area of expertise which Chores provides is in the area of outpatient therapies. Initially starting with one physical therapist in 1989, we have broadened that program dramatically. At this point in time, we bring 1 or 2 physical therapists, a wheelchair specialist, an occupational therapist, a speech therapist, and a prosthetist to provide very desperately needed care for these children. Care which, if we did not provide it, would not exist here in Grenada.
What kinds of things can you tell me that he's doing? Is he typically what happens is that we first start off at the hospital in St. George's, which is the main hospital, and we go to remote places throughout the rest of the week, different health clinics, and we treat the children here.
So we come up here every 6 months to provide medical care and equipment and supplies for the children. Here we don't have access to physicians. We have nurses and us, and that's about it. These are kind of the outlying nurses' stations where you would come to get your immunizations or to fill up a prescription. But if you needed to see a physician or go to a clinic, you would have to go into St. George's.
So we kind of go through and not only do our evaluation of how they're doing physically, but we also look at what they may need as far as medical care, so that we go back and we provide that information to the doctors and get arrangements set up so they can go to the main hospital.
They're diving me. I'm in Jacksonville.
It's all new to her, right?
That was very new, very new.
What'd she say when she got in bed?
Oh, she snuggled up and she kind of wiggled around and put her head on the pillows and she said, "A big bed just for me."
All closed, $2 a bag.
Yeah, 5, keep it.
Thank you very much.
Do I owe you change?
Oh my gosh, it's overwhelming.
Did you ever think that you'd have a chance to walk?
No. 2, 1, 2, 3. I'm sorry, honey. If I work hard, then I'll succeed.
I love you. You're working hard. Okay, thanks for working so hard.
The more we practice, the easier it's going to get, okay? We're in this together, okay?
I fell asleep.
Who were you dying to tell the most when you stood up?
My mom.
You know what I did today? You know what I did today? I stand up. I stand up. Yeah.
I would like to thank you all. Thank you.
Another area where Chores provides expertise are in the areas of contracting and biomedical engineering. Although it is easy to donate a piece of equipment to a developing country, the continuing maintenance of this equipment becomes problematic over time. This is where Chores is able to help out. By providing needed expertise in the areas of biomedical engineering and contracting, we are able to not only maintain these pieces of equipment, but improve the quality of care of health. By providing constant service to these pieces of equipment, we will ensure their functionability here over time.
My expertise involves facility, machinery, and stuff like that. The doctors do a great job of taking care of the patients, and if and when the machines break or the facility's not quite right, that's where my expertise comes in. I'd like to have benefactors willing to give more tools, give more material, air compressor with all the accessories, welder with all the accessories, transformers that would interface with the electricity here, UPS systems that would clean up, you know, our machines have a problem running on deficient power. Most of what I've done, I feel like, is increase the ability for patient care, aftercare.
Chip Drysdale is a paramedic educator in Jacksonville, Florida.
Scoop stretcher also has an advantage.
In Granada, Chip provides the majority of the medical education to the ambulance drivers and the police and fire rescue services.
Size of a blanket.
The country of Grenada has approximately 100,000 people, and those 100,000 people have the same type of car accidents, heart attacks, diabetic emergencies, fire-related injuries, and right now they do not have a standardized training program for emergency medical technicians or paramedics like we have in the States. The training, the guys respond very well to the training. We teach CPR, but we don't have the ability to defibrillate a patient. They may respond to a patient in a timely manner and do very effective CPR, but without some type of defibrillation equipment, they cannot convert the pulseless rhythm to a rhythm with pulse. Different splinting devices. Very often they're using splinting devices that they have reapportioned from the hospital. They don't have traction splints. They don't have airway devices which will keep a person's airway open between a transport from one end of the island to the other, which may take 30 minutes to an hour. And without airway, needless to say, try to hold your breath that long. These equipment, even new, only cost a couple $1,000s. And used, very little value to us, but great value to the Grenadians. I may feel like I'm not making much of an impact, but they seem to be very appreciative.
Tight. Make that big old muscle from there. You go.
Mike Richard is the prosthetist that accompanies the Chores projects here to Grenada. Mike is an amazing individual. From a pile of fiberglass and metal rods, Mike is able to provide limbs, both arms and legs for individuals.
You know, in the United States, if I disappeared off the face of the earth, there are other prosthetists there to carry on. Here, when you come, you're it. That is it. There is nobody to carry on. Prosthetic shop opens and it closes when I leave.
Mike makes people walk. It's truly an amazing thing to see an individual who has not walked for a number of years first fit on the leg that Mike makes for them and then takes those first few steps. The smile that they get on their face is worth coming here to Grenada to see.